Has your child or loved one been referred to a medical geneticist for evaluation? Is your physician recommending genetic testing and you're not sure why that's applicable or how it can help you? If so, this video is for you. Hello everyone and welcome to the channel where we endeavor to educate, equip, and encourage anyone who's raising a child with a neurodevelopmental disorder, special health care need, or behavioral problem. In this video, I give you 5 reasons why I typically recommend genetic testing to the patients that I see in my clinic. If you find any value in this video, like, subscribe, and hit the bell so that we can get this to more people. Let's get started. The first reason why I typically recommend genetic testing for patients and families is because it ends the diagnostic odyssey. Let me explain what I mean. Ending the diagnostic odyssey often means that further evaluations and diagnostic measures become unnecessary. Think about it. Every time you go to your primary doctor or a subspecialist, the question of why always comes up. Are we missing something? Every family Christmas, every time you're around loved ones or friends, the question often is raised, is there something more that we should be doing? When you arrive at a genetic diagnosis, often the answer to is there more that's necessary is quickly answered. There's no more need for MRIs or CT scans, abdominal ultrasounds, renal ultrasounds, or echocardiograms if those evaluations don't pertain to the specific genetic diagnosis. Number 2, the second reason to conduct genetic testing is that it often allows you to find your people group. Once you arrive at a genetic diagnosis, a number of opportunities become available. Yearly conferences, Facebook groups, listservs, and research opportunities all become accessible because you have a genetic condition that qualifies you. It gives you a direction. You begin down a path where you begin to work with people who know how to finish your sentences, who know your struggles, and help you understand what comes next. Oftentimes, these relationships become lifelong friendships of a community of people who know how to support each other in the most appropriate ways possible. Genetic testing and arriving at a genetic diagnosis allows you to find your people. The third thing that I want to mention is that finding a genetic diagnosis allows for meaningful surveillance. Let me say it this way. Imagine you're on a road trip and I was able to tell you that 40 miles up the road there was a traffic accident and traffic is backed up 20, 30, 40 minutes. You are going to be in a traffic jam if you don't change course. When we arrive at a genetic diagnosis, we're able to participate in what I'm calling meaningful surveillance, which means we only look in the areas that matter most. Does this particular genetic condition involve cardiac defects? If so, let's do an echocardiogram. Does this particular genetic condition involve learning difficulties? And if so, who should be involved in that assessment, such as a psychologist or potential need for IQ testing? What does this genetic condition tell us about future needs, such as vision or hearing deficits, or potential regression or seizure concerns? Understanding a genetic diagnosis allows us to provide you meaningful surveillance. So we only look for the things that are associated with the condition and we stop looking for the things that are not. Number 4, the fourth reason for conducting genetic testing is it allows us to quantify recurrence risk. If your child is diagnosed with a condition that has a known inheritance pattern, such as an autosomal dominant condition, the recurrence risk in future pregnancies is likely 50%. You may listen to this and think, well, what difference does that make to me? Because I'm not going to have any more children. And that may be true, but if you have children, it's possible that they could be carriers for this condition and have a recurrence risk that they have to navigate for themselves as they approach adulthood. Another important concept is the likelihood that you could have family members who are carriers for this condition and would also benefit from understanding the recurrence risk in their future pregnancies if they are carriers of this condition. Lastly, the 5th reason to conduct genetic testing is the end of guilt if this is applicable to you. I've been doing this kind of work for a long time, and if there's one thing that a lot of families have in common, it's they come in feeling as though their child's delays and medical needs are somehow their fault. My hope is, as you watch this video, you know, of course, that that's not true, but you would be surprised. Oftentimes, families look in the rearview mirror and try to determine what they did or could have done differently in order to prevent their child's delays or struggles. One of my favorite things to tell families when we've arrived at a genetic diagnosis is that there's nothing they could have done to cause or prevent this problem. Listen, you're fantastic and you're powerful, but you're not that powerful. You don't get to choose your child's eye color, hair color, or athletic aptitude. You certainly don't get to choose which genes they inherit. So those are the 5 things that I typically tell people in my clinic when they're concerned about whether or not they should proceed with genetic testing. I hope this video has been helpful to you. You're fantastic parents, you're fantastic family members, and your child or loved one is going to make excellent progress. If this has been helpful, please like and subscribe and check out our other videos. Thanks for watching.